Hello student. In last lecture we talking about the innate immune system and component of innate immune system. So in that lecture we talking about the anatomical and physiological barrier which provide the protection against the microorganism. And whenever the microorganism get inside our body system by anyhow by food or water, then it can be killed by the phagocytosis process. And this process also we see in the last lecture also. Okay, so many cells like an NK cell, macrophage, neutrophils, monocytes, the cells help in phagocytosis process. So basically, we see in that lecture that skin is act like a barrier for any pathogen because the body of organism is not sterile. There are many pathogen in and on of the body of the organism are live. And whenever this skin get ruptured, there is a chance of microorganism get inside of the organism's body. So what happen when this type of infection is happen on body of organism? So the innate immune system having the response against this type of infection or this type of injury, because this is the chance of pathogen to get inside of microorganisms body, because the skin is act like a barrier for this pathogen. Whenever the injury is cut occur on the skin, the pathogen get inside our body system without any barrier. So whenever this cut or this injury happen on the skin or any part of body, the innate immune system start to get response and try to heal that injury or infection. So that process is known as the inflammation. So in this lecture we're talking about the inflammation and what actually happened during the inflammation. So first of all, we see the what is meant by the inflammation. So inflammation is a induced by the microbial infection or tissue damage and is an essential mechanism of innate immune response. Proper inflammatory response provide a broad spectrum protection against this infection. Basically, this inflammation is a vascular and cellular response to trauma, and it is a purpose to initiate the healing of injured tissue. Whenever the microorganism get injured, their tissue or their skin, this inflammation try to. So basically, inflammation is a response against the trauma which caused by the any foreign material microorganism like viruses, bacteria, or any kind of pathogen. This response initiate the healing of that injured tissue, because due to this injured tissue pathogen get chance to get enter inside of the microorganism body. So the body attempt to dispose this microorganism or this foreign material or dying tissue so that the tissue repair can occur. So whenever the skin get injured, first attempt of body is to remove or dispose this microorganism, foreign material or dying tissue so that they can repair or start the tissue repair. So basically this inflammatory response may result from the external or internal factor. So basically, this inflammatory response or this innate immune response happen when the infection occur. So whenever organism get injured, this inflammatory response start to give the response against that infection. It may be microorganism, pathogen, or any foreign material, and try to heal it. So basically, it is a protective nature of the innate immune system against this microorganism and pathogen. So this it protect the body by localizing and removing this injuring agent, because this injuring agent can be make these tissue or that skin more injured or more rupture. So that this inflammation try to eliminate that foreign substance or foreign material so that they can heal that part of the body of the organism. So this inflammation protect the body against this injuring agent. So basically, this inflammation having some symptoms to recognize us that innate immune response is start against the injured site. So basically, the signs of inflammation is redness, which is called as rubor, then warmth, that is calor, then pain, which is called as bolar, then swelling, tumor, and loss of function. So let's talk about the signs of inflammation in detail so that we can understand what actually happened during the inflammation and what actually sign occur when the innate immunity start to get response against this infection or this injured part of the organisms. So this is the figure of the inflammation and the immune system which try to eliminate this microorganism or foreign materials and try to heal that part of the injured part of the skin. So basically in this figure you can see that this is a harmful thing which enter in the body which can. So this is the figure of inflammation and immune system, how it triggers the response against the any infection which is caused by the foreign body or any microorganism or pathogen. So in this figure you can see that this harmful thing get enter in the body of organism which rupture this intact layer of skin. So due to this harmful thing, the skin get ruptured and form the infection. So this is the ruptured skin, and we know that our body, that is organism's body, is not sterile. So whenever this intact skin, this which act like a barrier for this entry of pathogen, get ruptured or get injured, this is a chance of microorganism to get invaded in body of microorganism. So this is the site where microorganism can easily enter in the body of organism. So for this, immune system, innate immune system try to heal the that infection or this site of injury. So for that, they start the blood flow increase. Due to the increase in blood flow, we can see the redness in injured area in the compared to the normal area. So due to the blood flow, we see the swelling, warm and pain like a signs. So let's talk about in detail this sign, how it occur during inflammation. So first sign of inflammation, that is redness, which is caused by the blood vessel dilation. Because during inflammation due to presence of injury agent, vascular change start in blood vessel. So first and most change is dilation of blood vessel due to this more amount of blood flow through the inflammatory zone. And this increase in blood volume is also added by activation of inactive channel of the blood. So both these changes increase the blood supply to affected tissue called as active hyperemia. And hyperemia produce red color in the zone of inflammation which is called as rubor. So this inflammation or redness caused due to the vessel dilation, and this vessel dilation promote due to the chemical mediators. These chemical mediators contain promote the vessel dilation which contain the capillary wall and endothelium resulting in immediate response. So these chemical mediators include histamine, serotonin, bradykinin, prostaglandin, which increase the in arterioles diameter. So due to this increase in diameter of the arterioles, the blood flow increase at the injured site or injury. So due to this increase in blood flow to the injured site, we see the redness which is called as rubor. So this is the first sign of inflammation we see at the injured site. Secondly, whenever we see because of this excessive blood supply, slight elevation in temperature of affected part resulting in warming of the tissue on compared to the rest of body condition is called as calor. So we know that blood. So the second sign of inflammation is warm, which is called as calor. So, because of excess blood supply, slight elevation in temperature of the affected part, resulting in warming of the tissue on compared to the rest of body condition, which is known as calor. And this is result of chemical activity and increased blood flow of injured area. We know that during, so basically the blood is act like a temperature regulator of the body of organism. So whenever the organism get injured and the blood flow increase towards the injured site of the organism, so this due to this increased blood supply, the temperature get elevated at that site of injured site, and compared to the normal body temperature, because you can feel whenever you get injured, you can feel the place where injury are occur, that place is slightly heated, and this is occur due to the increased flow and the increased flow of blood and the chemical activity like prostaglandin, serotonin and other chemicals. So this is the second sign of the inflammation, which is helpful for the elimination of microorganism from the injured site. So talking about the next sign of the inflammation, that is swelling, or which is also called as edema, which is occurred due to the uh, more amount of blood supply and more amount of WBC, because before starting the clearing of the operation they must came out the blood vessel, which is called as integration. And normally in blood vessels, cell passes through central axis on the side of them protein, and then the plasma is permitted, so which is known as axial arrangement. And due to the dilation of the blood vessel, velocity of blood flow decrease, which is called as stasis, and this disturb the axial flow of cells and RBC. So WBC and RBC come closer to endothelium, and RBC, mostly the RBC didn't or couldn't leave the blood vessel, but WBC can send portion of pseudopodia outside and the blood vessel through the endothelium pores, and in the way WBC came out the blood vessel, and that is called as immigration. So due to the immigration, endothelial pores are increased in size through the few RBC pass out. So basically, initially the vessel permeability is only slight alter and no cells or protein escape. And the fluid is mainly water and dissolved electrolyte like synovial fluid. The capillary permeability increase and plasma protein escape the extravascular fluid, become cloudy, and this is called as exudate. The exudate is formed due to the vascular reaction endothelial of the blood vessel become more leaky. Hence, the large amount of plasma accumulated in tissue space, and this plasma accumulate in high percentage of WBC and low percentage of RBC than the normal blood, which is called as exudate. So exudate is any fluid that filter from the circulatory system into the lesion or area of inflammation. It can be pus-like or clear fluid. When an injury occurs, leaving skin exposed, it leak out the blood vessel and into the nearby tissue of the injury. So the fluid, which is composed of serum, fibrin, white blood cell, and sometimes leukocytes also, which is called as pus. So due to the formation of exudate, the swelling is seen in the region of inflammation, which is also called as tumor. So this edema or swelling occur due to the cell death or due to the fluid leakage. So increase in protein raise the extracellular osmotic pressure, drawing the fluid from the capillary. And these chemicals, and sometimes the chemicals alter the cell permeability due to the protein and fluid. And due to all this, that is from this WBC and RBC, which get outside of the vessel, a blood vessel, get accumulated in the site of injury, which show the formation of swelling or tumor. So this is a sign of the inflammation which trigger the swelling. Due to the enlargement of increasing tension of over pain fiber of sensory nerve and constant irritating pain fill in the inflammatory region, which is called as bular or pain. So it is result from the irritation of nerve ending from the physical or chemical factor. We know that the during vasodilation many chemicals are secreted, which is prostaglandin, serotonin, bradykinin, and these chemicals trigger the pain receptor of the organism. And due to this irritation in nerve ending of this pain receptor start to irritate this pain receptor, and the chemical mediators release when the cell damage occur, and these chemicals sensitized by the pain receptor. And this trauma may result in cell anoxia because the interference with blood flow due to the capillary damage. Whenever these chemicals or physical trauma occur, these trigger the pain receptor, which to signal the brain, and so that we can feel the pain at the injured site. So pain is a kind of sign of the inflammation, and which is also helpful for the organism to find out the injured site. So last sign of the inflammation, that is loss of function. So it may occur due to the pain causing the reflex guarding or muscle spasms. So basically, due to the bular or due to the uh, pain, the tendency remain towards the movement of organ is reduced, and these spasms decrease the metabolic activity and constrict the blood flow, which cause the more pain due to the ischemia, and thus the pain and spasm cycle. So when we know that due to the pain we cannot mostly use this organ which injured. So due to this pain we cannot due to the pain we cannot uh, do our function, regular function or regular activity, so that the any organ which get injured, that organ get lost their function or activity of the organism. So these are the signs of the inflammation, which is useful for getting the innate immune response, which trigger the regeneration of the site of injury, so that they can heal the site of injury. So in this lecture we talking about what is mean by inflammation and their sign like redness, then warm, pain, swelling, and loss of function. These are the signs of inflammation. In next lecture, how this inflammation occur and what actual phases are happen in the inflammation, we talk about that. So in this lecture we I hope you understand these lectures, so that you can understand the concept regarding to inflammation and their sign of the inflammation, which is the part of innate immune system. That is for today. Thank you.